This week we are going to learn about health interventions. Health interventions are strategies that are chosen to improve health outcomes. So when we are developing a health program or we're planning a health program, we get to the point where we need to implement the strategies to improve health outcomes within our population. So these are the strategies, the interventions are, and they're what you focus on during the implementation process. Interventions can be defined as the planned actions that are designed to prevent disease or injury or promote health in a priority population. There's a number of different ways that we can go about this. You could perhaps have a policy like the seatbelt law, or you could have an incentive to promote healthy behavior where you incentivize good choices. You might be aware of something like this in a health and wellness program where you receive a gift card or you get money off of your insurance if you do your annual wellness physical. There are many different types of activities that you can use as part of an intervention. Most activities can be placed in a larger category, which is called strategy. When we talk about strategy, we mean a general plan of action for affecting a health problem. The strategy you select can be considered your method, while the activity you use can be considered your tactic. An example of this is you might use a health communication strategy, and your activity may be to create a social media post. Before we talk about interventions much more, it's really important for us to understand Public Health 3.0 because we need to apply this lens when we're considering our interventions. Public Health 3.0 represents a new era of public health practice for the 21st century that focuses on collaboration across sectors and engaging communities to lead the change in public health interventions. So public health departments should partner with stakeholders from public and private sectors to take collective action in public health interventions, with special focus on addressing the social determinants of health. Understanding that public health issues are complicated and affected by multiple systems, a more integrated systems thinking approach is necessary for Public Health 3.0. Whatever sector in which you work, your role in intervention planning will require you to collaborate with stakeholders who work in different agencies and across the public health system. Additionally, you're going to want to be attentive to engaging your community to develop sustainable interventions that meet the needs of your audience. Another thing we need to talk about before we move on to designing an intervention or talking about examples of intervention are logic models. Logic models are also known as a theory of change, and it's a systematic and visual way for planners to share and present their understanding of the relationship among the resources that they have, the activities that they want to implement, and the output and outcomes that they hope to achieve within their health program. They can take many different shapes. They can be linear, circular, or lists, and be presented in various levels of detail, such as simple or complex. But all of them depict the relationship and linkages of various components in a graphic display. Simply put, it is a roadmap for you to share with others about how you see or envision your intervention being implemented. There are a number of different components to each logic model that you need to be aware of. Inputs are our resources, activities or our interventions or strategies, outputs are evidence of activities, and outcomes are the results or effects that we want. When we talk about outcomes, it's very, very important to remember that these usually need to be broken out into short-term changes in awareness, attitudes, knowledge, or skills, mid-term, like a change in behavior, or long-term, which is risk reduction, change in health status, or quality of life. There's some common considerations that you need to be aware of prior to developing or planning an intervention. In order for interventions to be successful, we need to think about a number of different factors. They need to address one or more risk factors of the priority population. It needs to be theory-driven. It needs to be based on the best possible evidence that is available. It needs to adhere to professional ethical standards. It needs to be culturally appropriate. It needs to be consistent with professional criteria, guidelines, or practices. We need to be able to use resources efficiently. We need to include an evaluation component, which is why we talked about evaluation in previous weeks. And we need to support the community initiative through the buy-in of the design for the intervention. If we have these characteristics as part of our intervention planning, it can really help to make sure that we have a successful intervention. There are actually three different possibilities when it comes to implementing an intervention. When you think about or you brainstorm intervention ideas, the first place that you want to start is to discover whether there's any existing interventions that can be adopted for use in your community. For a program planner to adopt an intervention for their program, you need to ask yourself several questions. And if you respond to yes, you can adopt the intervention for your population. These questions include, is there sufficient evidence to show that the intervention was successful? Is there sufficient evidence to show that the intervention has been successful in dealing with the problem in question in a population similar to mine? Is there evidence to show that the intervention was successful in more than one setting? Are there similar resources available in my setting as there were in the evidence that's being presented? Is the new environment setting similar to the environmental setting identified in the evidence? If for some reason you answered no to any of these questions, then you need to be considering whether you adapt an existing intervention or you develop a new intervention. If the answers to the questions are not clearly yes or no, then you actually could benefit from a further discussion with either people that have put the intervention into place or your stakeholders. If the evidence supports adapting a current intervention, you're going to select a intervention that's successful in another population that had outcomes that you were looking for, and you're going to adapt it to your specific population or your specific health outcomes. If we're going to design a new intervention, there are a few questions that we need to ask ourselves. What needs to change and where is the change needed? At what level of prevention will the program be aimed? Is it going to be universal or selective? At what levels of influence will the intervention be focused? What types of intervention strategies are known to be effective from research? Is the intervention an appropriate fit for my population? Should I tailor it? Tailoring is defined as any combination of information or change strategies intended to reach one specific person or population based upon characteristics that are unique to that person or population related to the outcome of interest and have been derived from an individual assessment. That's different than segmenting, which is the process of dividing a broader population into smaller groups with similar characteristics that are likely to exhibit similar behavior reaction to an intervention. Segmentation will allow you to create an intervention to fit the needs and characteristics of your priority population. When we're designing a new intervention, we also want to make sure that it's culturally sensitive. Interventions need to fit culturally within the priority population. Culturally sensitive interventions are those that are relevant and acceptable within the cultural framework of the population to be reached. In attempts to be culturally sensitive, because culture is often context specific, you need to be careful not to perpetuate harmful cultural stereotypes. We also need to consider necessary resources. Are there enough necessary resources available to implement the intervention that we selected or that we've developed? Would it be better to use an intervention that consists of a single strategy or one made up of multiple strategies? Multiplicity refers to the number of components or activities that make up the intervention. We have known that interventions that include several activities are more likely to affect the priority population than those that consist of a single activity. However, when we have multiple activities, they require more evaluation, more resources, and more implementation strategies. Design thinking is an analytic and creative process to help people and agencies understand a community's needs, experiment with possible solutions, and create a solution prototype, like a health promotion intervention. Embedded throughout the design thinking process are multiple opportunities to gather feedback from stakeholders, which is really important when we think about the Public Health 3.0 framework and, in general, actions taken in public health. Design thinking can help us to keep the community's needs and priorities in mind at all times and reminds us to be attentive to gathering feedback throughout the process. There are 5 stages that we need to consider when it comes to design thinking. First, we need to empathize, get to know the community, and seek to develop a deep understanding of the health issue. Then we need to define, articulate the priority health issue that needs to be improved. We ideate, which is brainstorming and reviewing the literature for potential strategies to address the public health problem. Solicit feedback from the community or stakeholders. Then from there, we develop a prototype, which is selecting a potential solution and develop the intervention. We then need to pilot test the intervention. Test is working with the community to do further piloting and design improvements to develop the best intervention for our specific population. There are a number of different ways to describe interventions, and we'll get to types of intervention in the next slide. But we can also group them basically based on if we found it through research or it's a rather new or coming out intervention. When we talk about interventions that are evidence-based, these are those that have been peer-reviewed via a systematic or narrative review. So this is when the intervention has been applied to a population and it's been applied multiple times, and science has found that it gives evidence that it works in different environments and different populations, and they give it the terminology evidence-based intervention. Those in the second level are effective interventions, and they have been peer-reviewed but are not part of the systematic or narrative review. It's not like an article that appears in a scientific literature like we have with evidence-based interventions. These interventions may be very good, but they have less evidence backing them. These interventions are deemed effective via a program evaluation, but without formal peer review. We have the third level, which is promising interventions. These are usually state or federal government reports that have not gone through peer review. Our final and fourth level is emerging interventions. This level includes ongoing work, practice-based summaries, or evaluation works in progress. Often emerging interventions are created by people based on their knowledge and skills of good planning processes and including the involvement of those in the priority population. Due to the lack of existing evidence, the application of appropriate models and theories is especially important when interventions are promising or emerging. Like we discussed before, and I'd like to highlight again, we need to make sure that the intervention is appropriate for the resources we have and the community that we're working with or the population that we're working with. It is very important to make sure that it is tailored. We may have to segment the population, and we need to consider this prior to implementing an intervention. And we need to be culturally aware or culturally sensitive to make sure that we receive buy-in from our population. We also need to consider, as stated before, if we're going to have multiple or single interventions going on at the same time. There are pros and cons to having multiple or single interventions. So it's really important to consider this prior to implementation. It can be helpful to use a systems approach when planning an intervention. Systems approach refers to the interaction and interconnectedness of people and agencies who help to solve a health issue together. When individuals or agencies act together, they can become a system. Health promotion issues that are really complicated problems because the issues are typically intertwined with problems like poverty, racism, and other social economical determinants of health, is why it becomes really important to be working across agencies and throughout the community to develop an intervention that will work for your population. That's why you need to engage stakeholders at all points and all times during your intervention implementation and planning process. There is no formula, no exact formula or science for solving health problems, and sometimes you do get yourself into a bit of a trial and error. But if you go about it in a by following a method or following processes, as well as talking to stakeholders and ensuring that your community understands what you're doing and has buy-in, you're likely to be more successful in having a good health intervention. And this is the reference for this slide deck.